how do we celebrate those steps? Not just, I need you to do this, and otherwise, if you don't matter to me. Every step matters. And so being able to have the personalized pathway that really is a pathway. It's not just the end state. It's not just meeting the goal. It's the pathway.
Welcome, everybody, to Navigate's People First podcast. Thank you all for joining us, and continue to subscribe and like our podcast if we are bringing value to your day. Jeremy and I are back with another episode, and this time we're joined by Stephanie John, Director of Team Member Wellbeing at Prisma Health. Today, we are digging into how one health system, their approach to employee engagement, benefits well-being as part of their entire organizational strategy when it comes to their people, their community, and how they're doing good, bringing a culture of care, collaborating with different sources, doing listening within the employment side, the community side, and really using data points as proof points to their overall strategy. Stephanie, it's awesome to have you part of this podcast. I've been looking forward to this one. Jeremy and I, between data and engagement and the energy that you bring, health and well-being, it's just wonderful to have you on the podcast. So welcome, and thanks for being with us today.
Thanks for inviting me. I'm excited to be here. And feel free to call me Steph.
Oh, Steph. Okay, we can do that. Stephanie, Steph. You have a wonderful background when it comes to health and well-being. You have a pretty unique background when it comes to health and well-being. Can we get started there? Maybe give the audience a little bit of background of your education and your experience, and how that kind of came into the whole well-being strategy of where your career is led.
Yeah, absolutely. So part of why I tease that people are welcome to call me Steph is because in my role as the Director of Team Member Wellbeing for Prisma Health as a healthcare organization, a lot of times people would assume that I may be a doctor or a nurse. Nope. What I am is I am a licensed marriage and family therapist, which basically means that I win all of the arguments at my house. So, no, but really what it means is that I come to appreciate that Prisma Health kind of leaned in and looked at the totality of wellness and recognized that for me, I'm trained in systems theory, which is basically this concept of that everything we experience contributes to our next experience. It contributes to our perception. It contributes to how we see the world, how we function in the world, how we interpret the world. And so I'm like a kid in a candy store working for a health system because there's so many experiences that are happening every day for our team members, our patients. And so for me, I just want to emphasize that, yes, wellness could mean asparagus and exercise, but it also means relationships. It means your mental health. It means your financial wellness. It means all of those things. And that's what we really embraced here at Prisma Health. So that's why I tease. I'm always like, yeah, feel free to call me Steph. I'm not a doctor. I don't play one on TV. But I am really glad to serve as the Director of Team Member Wellbeing.
When you think about team member well-being and you think about employee engagement, benefits, you're really using well-being as that holistic umbrella when it comes to all the things in your culture of care. You've got a unique background of two health systems coming together. We're seeing that in the marketplace, a lot of mergers, a lot of acquisitions. When we first started with Prisma Health, we're talking about two health systems coming together. We talked about merging two cultures together. That was our first strategy when we first started talking with one another and earned the right to work with you guys. Maybe dig into that a little bit, because that seemed to be the foundational need and where we started to build upon where we are today.
Exactly. So we had two successful health systems that decided to come together for a partnership, right? And that brought together Prisma Health. But, and forgive me, being a therapist, I can't help but draw the analogy that it's like two high-functioning adults deciding to be in a relationship together. One entity had their things, the other entity had their things, and it was kind of like, okay, whose stuff are we going to use? And we were working really hard to figure out what was going to be the culture of Prisma Health. And so even though both entities had a wellness strategy in their previous lives, as we were coming together as one Prisma Health, it was kind of like a couple deciding, all right, I have a coffee maker and you have a coffee maker, but whose coffee maker gets to go on the kitchen counter? And so we actually elected to move forward with a different approach. And that's why we were really thankful that we found Navigate Wellbeing Solutions to partner with us and really kind of build a foundation of what the culture of wellness would look like here at Prisma, where it wasn't just a one size fits all, where it recognizes the diversity of our workforce, where we talk about wellness as multidimensional. And we didn't try to assume that we knew what people wanted. We wanted to offer them choice. And so that's why it really felt like a fresh start to build it together as Prisma Health. And we affectionately call it our Prisma Health Wellness Portal. And of course, that's being brought to us by Navigate Wellbeing Solutions. But that's really where we were able to set that foundation and then build from there. And since we started with you guys, it's just grown and grown. And we appreciated how you've been willing to collaborate and adapt to our needs.
Thank you. And I appreciate that endorsement. That's wonderful. We need to send Stephanie a vest. One of the things I think that you folks really started to address right away was all dimensions of health. You acknowledged employee well-being, physical health, the considerations of financial security, mental health, social connections, work-life balance. You guys brought all of that together in the forefront. And one thing, Jay, I know that you worked on specifically with Prisma Health was collaborating to create that unique survey that really asked questions beyond what our existing survey had, but really executed on what Stephanie, Dr. Brown, Prisma Health's overall strategy was by asking definitive questions around that all dimensions holistic well-being. Maybe Stephanie, talk about the strategy around that. And then Jay, do you want to maybe like get into like the configurability behind that and how we were able to help on that side?
Yeah. So as you can imagine, being in a healthcare system, a lot of our team members actually experience some level of survey fatigue, right? And so there's a dynamic of like, okay, great. What questionnaire do you want me to answer now? And so there was a level of credibility that we needed to establish and really asking the right questions at the right time to get to information that would be helpful to our team members. And so what I like about the survey is that one, it's multidimensional, right? Like it's not just, height, weight, things like that. It's not just, do you like this or do you like that? My probably top favorite thing about the total health survey is that it also gives you an idea of readiness to change. So for example, right, if I do the total health survey, it's going to show that I need help in the area of nutrition. I probably eat like a teenage boy. Mountain Dew and Taco Bell are my food choices. And so again, it's going to tell me, hey, you might want to take a personalized pathway of nutrition resources. But when you look at the readiness to change, you're going to see that, nope, I'm not ready to give up my Taco Bell. And so the survey actually does a lovely job of allowing our team members permission to really weigh in on where they're at. Where are they at with mindfulness, community, nutrition? And so seeing some of those dimensions just kind of opens our eyes to one, a level of awareness and also exploring like, okay, well, what if I wanted to have a stronger connection to my community, more social connections, but also being able to say like, yeah, that might be what the need is being identified as. But if I'm not ready in that domain, then how do I look at other choices? And so that type of fluidity, that type of opportunity, I think matters to our team members because choice matters. People do not want to be told that they have to do this. They would like to see some pathways illuminated for them and some options created that meet them where they're at.
So Jay, the personalization behind that survey and the value of consistent data to be able to really bring back that ROI and how we're connecting with people, maybe connect those dots there of that interoperability of data and all that coming together.
It's really difficult to bring back relevant data at scale at the same time as being flexible to our clients' needs and being able to personalize at a participant level. So you've really got to put a lot of thought into that. To Steph's point, we actually doubled down on readiness to change in our questionnaire. Not only are we asking sort of a question to get at your readiness to change, we're asking a question of your willingness to participate too. We're trying to take it one step further so that we can blend, are you ready to make a change, but are you actually trying to figure out if you're actually willing to go there? Not just ready to go there, but kind of excited and amped up to take down that track. So that gives us an added dimension of being able to judge a participant's willingness to sort of participate in the program. And Steph, you hit it right on the head when we're talking about, we're not trying to find the exact answer, because it's so hard, it's so challenging to find that from a survey. We're trying to narrow down some options. We're trying to give you a few choices that are going to make sense for you. And that may vary day to day or month to month. We want to make sure that you can take that where you want. But for us, it's about giving tools, not just giving tools that are clinically, medically valid, but giving tools that are valid across a giant spectrum of what well-being has become and what our like excellent employers want to do with their employees, which is very, very broad these days.
When we first looked at the entire scope of benefits and opportunities that Prisma Health was offering employees through a resource audit, I looked at that, and the first thing I had asked was, Steph, what does your team look like at Prisma Health? And I'm going to ask it again. Hey, Steph, what does your team look like at Prisma Health?
What I am fortunate in is, though, even though I may be small in numbers, I have a lot of support. So I do. I lean on our total rewards team. I lean on benefits, compensation, everyone. But really, when it comes to wellness, it is a small but mighty team of one. And that being said, I have to lean on the different ecosystem of the benefits that we have and look and see, how do I support 30,000 team members? And really, that's where my main role is to listen, right? And so tag being a therapist comes in handy, right? How do I listen in various ways to those 30,000 team members? What is it that they're telling me? And then how do I help them navigate the ecosystem that is the resources that we have to offer? And so that's an aspect of, again, that readiness to change really matters to me, right? So again, we offer a lot of things and it can be incredibly overwhelming. But if you have a tool that helps you kind of filter through and say, this is really what I'm ready to address, and then it can point you to, like, I'm so glad you asked. Here are the resources that may fit. And what's nice is then we can highlight some of the resources that maybe don't always get attention, or maybe somebody would feel a little bit like, oh, I didn't know that is what it does. For example, EAP. Sometimes people don't know that financial resources are available through EAP. There's just a lot of myths that can be demystified by really allowing for a personalized pathway that routes somebody where they need to go. And for me, a team that's small but mighty, it's really helpful to have something that helps me kind of listen to the team member and guide them to the right resource with the confidentiality that I think people want. And then from an aggregate level, the system is then able to say, okay, our team members really are leaning in and saying that they are looking for resources here, or they need this type of resource, and maybe we don't have it that's meeting the need. So then we can really be strategic in what we offer and pay attention to what the aggregate data is telling us that our team members want and are ready for.
In going back to the team as one, I think in a world where there's vendor fatigue and there's vendor PTSD. And really what we were motivated to do is really establish trust with Stephanie and the team at Prisma Health. And I think that, a lot of folks say, hey, we're an extension of your well-being team. Steph, we're an extension of your well-being team. I mean, we're here to help. I think about Kim and her team on the healthcare side of things, really, encouraging listening, encouraging collaboration, that very configurable and personalized approach that we brought, to Prisma. That was the first thing we had to establish, was trust. Maybe talk about that a little bit, because we had established trust with you when people put their toasters away. New toaster here, but then also, what are we bringing to our employees to potentially, establish trust with them and that positive employer brand that we're trying to build at Prisma Health?
Exactly. So one of the things that I have to say is that it feels so good to be able to collaborate, right? And so it's not a one size fits all. This is what you have. Go put it out as your wellness portal. It really has been I wonder if we could do this. And the opportunities to meet with Libby and Kim and sit down and be like, this is what we think our team members are telling us. This is what we're hearing. Is there a way that we could highlight this? There's this new resource, but maybe nobody has 2 minutes to rub together to learn about it. Can we incentivize them to just learn about it? And I think that's really where the collaboration to meet people where they're at, right? And help them say, hey, We're actually putting our money where our mouth is. We are giving you points. We're incentivizing you. We're rewarding you for learning about these different domains of wellness. And the fun part is getting to be creative about how that learning comes to life, whether it's visiting a link or giving us their feedback. That's been a lot of fun. Libby's helped us create forums where team members get to give us their feedback. What was one thing you learned out of this recent event? And feedback like that helps us. Was that a beneficial thing? Was it not? And so even though I may be a small but mighty team, when I get to collaborate with Libby, with Kim, with all of the wonderful people with Navigate Wellbeing Solutions, it's like the team is vast and the possibilities are endless. And for us, we've changed. In our first year, it was kind of this is the list of activities for that calendar year. And then we were like, what happens if we do this by quarter? And we unveil new activities every quarter. And we have foundational activities that are available all year long. And now we have a business resource group, our whole self wellness BRG. I meet with them every month and they weigh in. They're like, could we find out if the portal does this? And they were like, can we do this in the photo gallery? The ideas have been endless. And what's been nice is that now the system understands that we have a partner who's listening and creative with us. And then they're kind of eager to see what we can bring together each quarter and how they can continue to earn points. And that's why it's been fun too. Even though team members can earn a maximum amount of points every year, we have a lot of people who just continue to participate because they think it's fun. And that's the engagement we're looking at, right? We're looking at it to be more than just transactional. We're looking at it to be meaningful.
Stephanie, you and I, we've talked about this before, but, it's more than just I participated, it's that I benefited. When you think about creating that culture of care foundationally and bringing those two brands together, incentivizing, going quarterly, bringing in different vendors and us being that billboard for all things employee. When you think about your transition to total health, maybe give me some line of sight on the guiding principles that you decided to say, hey, we're going to move on to Navigate's next stage, which is total health. Maybe some guiding principles that took you there.
Yeah. So, for example, again, and I tease about this all the time, is, wellness is more than, exercise and asparagus, right? And that's not to discredit that. So from a health outcome standpoint, we've appreciated that there are aspects of nutrition, of physical fitness, of those types of things that total health looks at. And then to be able to route people to, like, did you know you can have a health coach here for free? Did you know that you can participate in these classes? All those types of things. Then fast forward to what we're trying to do with biometrics, where we're able to say, hey, not only if you know your numbers, have that awareness of your numbers, are we giving you points for that? But also when you make progress, we want to celebrate that. The health outcomes in the state of South Carolina are not ideal, but that's why Prisma Health is here. We're trying to change that. And so we don't want people to feel like they have to meet this standard in order to get points. We want to be able to say, are you making progress? If you're making progress, let's celebrate that. And so the journey is really important, which is where the personalized pathway is important. What somebody is trying to achieve, how do we celebrate those steps? Not just, I need you to do this, and otherwise, if you don't matter to me. Every step matters. And so being able to have the personalized pathway that really is a pathway. It's not just the end state. It's not just meeting the goal. It's the pathway. So you're right. At the beginning, it was all about, did you participate? Like, did you just click? Do you now know this exists? We started off incentivizing there. And then it started to be like, okay, now that you know this exists, are you willing to set goals, personalized goals? Let's celebrate that. And then it became okay, did you meet that goal? Now let's celebrate that. And so that's really where we feel like we've been able to, one, get a lot of traction and a lot of data on, are we driving people to the right resources? Then it's actually helped us hold the resources accountable, because now it becomes we know they're aware of you because we know they've visited your site, which is where the recommendations out of the Total Health Survey are super helpful, right? Because not only do they get recommendations that they can visit within the wellness portal, they also have Prisma Health recommendations like, hey, by the way, did you know about this? So we're able to talk to kind of our ecosystem of vendors to be like, we know they're learning about you. Now that they've learned about you, help us understand what difference is being made in their wellness journey. And so that's really created a moment where I value relationships, obviously, therapist, hello. But this is where I like to be able to point to data to be able to say, are you making the difference in my team members' lives that I needed, that you said you would? And how can I use the data to hold them accountable? Because if a breakup is needed, I want to be able to point to the data.
Yeah, it's a accountability partner when it comes to navigating people to the right resources. And Jay, going back to total health, we're all stewarding our budgets the best way we can. So when you think about the data specifically out of Prisma Health, maybe share a little bit of that, of the uniqueness of that data and how you're excited to share that.
I don't want to steal from Stephanie's thunder, but I feel like it's also our thunder too, because we've been able to help Prisma achieve some pretty fantastic results. Their engagement rates are through the roof, especially for an organization their size. How we define engagement, which not to toot our own horn, but I'm pretty proud of the way we do it. And it's not just about participation. It's not just about incentives that people have been awarded. It's about whether or not people are actually doing the things that we know will drive behavior change. We know will get them, quote unquote, engaged.
Addressing their actual needs.
Yeah. And when you're able to work with a partner like Prisma who puts the thought into it, and I think for a large part, we're able to give a small but mighty team the ability to not worry about the details, or not worry about the operations, and that you're able to think and you're able to listen. And I think largely that helps the results that we're talking about. And when we talk about seeing overall engagement rates for total health somewhere around 75% as we define it, not just, sort of reading your messages, I think that speaks volumes, and not just our regular engagement, high engagement up in the 60 percentile. That's pretty positive. But to me, what really stood out and what stands out across, not just for Prisma, but for everybody on Total Health, is taking advantage of those those personal pathways that are driving people to resources. And our goal when creating that was always around the participant journey. It was getting participants to the resources that they need to. But there's a secondary thought behind all of that, and making sure that the resources we have are resources that we need, and that there can be less of an excuse of, well, we're having trouble getting people to us. But if we get them to us, they work. Well, we just introduced a concept that gets people to them at a rate at Prisma of 62%. So if you're involved in the program, 62% of the people got to the resource that was recommended to them. To me, that's incredible. I think that ultimately it's doing a really good thing for the people of South Carolina and the people of Prisma's health systems. And hopefully we're helping Steph keep costs under control and hold people accountable for what they're promising.
Steph, has your partners seen, or have you heard things from your other partners about, this unified platform that Navigate provides, and us utilizing, that navigation towards the result? Have you heard anything from your other partners? What have you heard, and how has it benefited or not benefited?
Yeah, I remember the very first month we went live with the Total Health Survey. I had partners coming out of the woodworks going, did you just see how many people went to our site? And I was, and bear in mind, that's not necessarily something that I directly see. So I would have partners, for example, we have a posting Flourish where we routinely share health related information. And literally they reached out and they were like, we have never had engagement like this. And I was like, tell me more. And it was literally just a few weeks into the Total Health. So it was so quick, wow, people have been routed here. And then became a little bit just like Jeremy was saying, of like, okay, but was it just one click? No, they were exploring, right? We were able to do the analytics, and it's like, no, once they understood that the resource was there, they continued to check it out. And so we even had the after effects. So even if you were guided to our health coaching, did you realize that we had all of these wonderful programs, Lose Well, Choose Well, Fit Well, all these other programs? So once we got them to the front door, and really the Total Health Survey said, here, I've got you to the front door and you can ring the doorbell. That door opened and those resources became evident to the team member for their choosing. And team members at that point, having been supported in a non-judgmental way, were ready to walk through the door and see what was out there. And so again, now for me, it's this place of awesome. What do you want to see? And I have now our vendor partners, but also our internal partners, right? We're a health system. They're also like, we would like to be a part. Is there something we could promote? And so people are coming to me with ideas, which, as you can imagine, a small but mighty team, it's so nice to have people be like, is there any way that this could be featured on the wellness portal? We think team members would benefit by knowing this. And so it's been such a nice dance now to be like, tell us your ideas. I can't tell you the number of times that I've introduced Libby and Kim to like, let me introduce you to this learning partner or this partner. And then the brainstorming takes place. And it's the part of my job that I find the most fun. And then I get to meet with the whole self-wellness BRG committee and be like, what did you think of that? And they were like, that's awesome. Next month, can you do this? And so we tweak, we refine, but being able to point to the data, being able to have a pathway that gets my team member to the door, and then it's up to them what they do next is refreshing as well as invigorating.
We need that in HR. That's awesome. We need to continue to do that, right? Steph, you made me think of a couple questions. I love that you brought up your internal services at the health system. One of our strategies and one of our jobs at Navigate is really being able to say, how can we help get people to the right resources at the right time? And if those are internal resources at the health system, for me, we've done, two wonderful things. Maybe this is from a kid whose mom was in healthcare, HR for 35 years, but we've driven folks to the need that they're looking for, one, but then we've driven it to the hospital system. So in turn, we're driving revenue back to the health system within their internal walls. They're not walking across the street. And so not only are we helping the individual, we're driving revenue, but then we're also creating that positive employer brand that we're not walking across the street. We're keeping our employees in our doors, and hopefully that, retains them, but also attracts other people as well. So that those three aspects of that's just a win. I think, we talk about playing chess, not checkers. That's a great chess strategic move of being able to bring some things together. Any thoughts on that, or how your approach is to those internal pieces again?
Absolutely. So one of the things that we recognized, and it was like, oh my gosh, how do you convey this message? You would feel like it was understood, but maybe it wasn't. And the message was how important it is to have a primary care provider, a primary care physician, right? And we were finding that a lot of our team members were then telling us like, I don't have time for that. And so how did we convey the message that, don't get me wrong, our role is to serve the community? How do we make sure our team members understand, absolutely, we want to serve the community and our team member wellness is important. It isn't an either or. We can say that the community's wellness, their physical health, their well-being is incredibly important, and so is our team members. And so really being able to prove through our actions and behaviors that how can we highlight, promote, incentivize, remind our own team members of, do you know how to have a primary care physician? Do you have one? Do you need help scheduling one? Can we help you with that? Wake up with the sniffles. Do you know where you can go to get same day or next day care? And so that is really where we leaned in to listen to what our team members were telling us. And our team members are so devoted to the care of the community. It was very eye-opening. And especially as you can imagine in the throes of COVID, it was eye-opening that our team members were. They were absolutely pouring themselves into the wellness of the community. But sometimes it was at the peril for themselves of not prioritizing their own wellness. And so really us coming forward with this, being able to put it front and center, to be able to incentivize it, to be able to make it a few quick clicks to know where to go, and to feel supported. I feel like that's really where we created a level of trust and buy-in, that this wasn't just lip service. Because again, I imagine most companies, that is what you want to message, is that we care about your well-being. But what are you doing to show that?
One of my favorite stories is how you took a Kmart and you turned it into a COVID vaccination center within like 2 weeks. And it was just like, you were diving into the community, you served your purpose, and you turned it into a great opportunity when it comes to how Prisma is connecting the community. I love that. We sometimes get this funny look from folks. We're like, how are you tying the community into your well-being program? And for you guys, it is an absolute variable.
What we're seeing is that one of the key engagement drivers of a well-being program is knowing that where you work is dedicated to where you live. So if you work locally and someone is investing in that community, you're going to have a better experience. You're going to be more engaged in what they're trying to do. We've seen that across our book of business. So incorporating a community aspect to your well-being program is a key driver of we've had last episode's podcast where we talked about our engagement drivers with Jen. The incorporating that piece into your program is a key engagement driver. We know it will drive a couple of percentage points of engagement across a book of business or across a large organization like Prisma. That's a significant number of people that are getting involved simply because there's something they can do. Go out and get motivated, go out and get involved, go out and talk to people and see people, or just take advantage of the things that they're already doing and realize that my employer supports this. My employer wants me to be doing that. It's as simple as going out and meeting people, going out and getting active, going out and doing things. And that's valuable both to employer and to yourself. So everybody should take advantage of that.
And in one of the fastest growing communities in America, Greenville, Spartanburg, I mean, that's an X factor, right, Steph?
Yes, we're like a chia pet. Like it is. We keep growing, and then we have to like adapt to what that is, right? And so that is what Prisma Health does. We are resourceful, we are resilient, and we are ready to adapt to whatever our community and our team members need. And so that flexibility is huge. And to that point about community, it's even one of the features, right, in the Total Health Survey, that kind of sense of community. We then decided to like even emphasize it more, where people can then also get points for service to the community. And I know sometimes people are like, wait a minute, doesn't that kind of defeat the purpose of volunteering if you're getting points for it? And we're like, no, we feel like people do not understand the wellness benefits, like the actual health benefits for being connected to your community. And so again, it helps us put the right emphasis on the right syllable. Get it?
Yeah.
By actually making it.
It's good. It's good.
Right? And
The other thing,
even though, yes, it's volunteering, you're doing something technically for free, but part of why we're incentivizing it is to call that attention of this is so important and we're happy to celebrate you when you do this, that you're taking this moment for the community, you're taking this moment for your wellness, and we're happy to celebrate you in that.
Steph, one of the things I see with Prisma is it's such a simple thing. And I'm kind of tangenting a little bit away from community, but it's an incentivization of your program, and that it seems so simple, but you're incentivizing the behaviors that you want to see out of your participants. And that's where all well-being and wellness starts, is understanding what results you want to see. I want to see people go to the doctor. I want to see people take advantage of the resources that they have. I want to see people take advantage of getting out into the community or getting social with coworkers. Whatever that is for each individual organization, you guys have really sort of nailed where you want your participants to be because you understand what drives health outcomes. And I hope we were able to help a little bit there. And for anybody listening out there, to me, the key thing that Prisma is doing better than anything else is understanding their population and building a program that supports their people. And it's going to drive people to doing healthier behaviors, whether it's physical activity, nutrition, financial, community. It seems like such a simple thing, but it's really one of the most challenging things to do, is to build a program that is incentivizing people to do the behaviors that we want them to do and we know will help them out.
Encouraging healthy behaviors and preventive care leads to a healthier workforce, which leads to lower healthcare costs, improved health outcomes. I mean, line it up, and the numbers are there. Steph, when you think about other programs that you have incorporated within your program, you guys launched financial well-being. a few years ago. Very positive response to that. One of our ecosystem partners. Talk to me maybe a little bit about that, about connecting those dots and then bringing that data together.
Absolutely. So again, we are focusing on kind of 4 pillars, but as you can imagine, the 8 dimensions that the Total Health Survey highlights really is emphasized here. So we look at it from physical, emotional, financial, and work-life harmony. And so that really helps us to encompass all of those different dimensions from the Total Health Survey, and help us talk about it in concise ways. And so when people are a little bit surprised, though, to see that we've dedicated a whole dimension to financial wellness, they're kind of like, okay, none of us are immune from the unexpected financial emergency. And so it's one of these unique opportunities. And again, not to lean again on being a licensed marriage and family therapist, but I know what families came in and struggled with. It was that they weren't talking about their finances. It was the elephant in the room. And so let's be real. If you're not talking about it with your loved one, do you really think that at work you're talking about, like, gosh, how is my taxes? Do I have to do Medicare when like all of these questions? And so being able to lean in, one, we found out real quickly that when people were doing the Total Health Survey and they were being routed to a financial wellness personalized pathway, the resources that we had from Pete the Planner, Your Money Line, were getting gobbled up. And again, I bebop around all 12 campuses. I feel like I know all 30,000 of our team members. It's part of the fun of my job. And I loved being pulled aside by a unit secretary or, someone, walking the halls and being like, that video was awesome, or that challenge was awesome. And so whether it be through the videos, the articles, the resources, or the partner, we're able to get our team members the resources they need in a convenient way. And then we're able to shine a light on it so it takes away the stigma. And so, for example, we do April Financial Wellness Month. How can we talk about that? We do Mental Health Months, right? We talk about childcare. We talk about, does your fur baby need care, right? Because pets matter too. So we're okay talking about pretty much any and all of this. But it really did open our eyes when we saw that the personalized pathway was routing people to video courses about financial wellness, and that our team members were experiencing so much satisfaction. They were completing those things. They were completing the personal challenges. And Jeremy, to your point, sometimes you would think it's so simple, but when you can shine a light on it and you make it okay to talk about it, it does big, big differences in people's everyday lives. So we're about to do the Your Best Rest challenge. And it's one of those things where, yeah, we're holding people to this, hey, report out if you're getting 8 hours of sleep. Now in healthcare world, a lot of people roll their eyes, but we're creating a conversation around, let's try to make sure we're honoring our sleep. What do you need? What are those resources? And that's where we've been able to bring in other vendors who actually can help us with mindfulness, meditation, sleep, relaxation, all of those things that matter to us. So sometimes it's the little things that you think everybody knows about, but when you can call attention to them, you can bring awareness, a sense of unity. And again, if you can put a challenge to it, our very competitive workforce loves it.
So Stephanie, one thing I did want to ask, when you think about the future, what do you foresee happening in the well-being industry within the healthcare space and maybe just workforce in general?
I think right now we're already seeing an aspect of it. So right now at Prisma Health, we have 5 generations working at Prisma Health. And so how you share with your community when you've got 5 generations, how do you meet them where you're at? The skill set of communicating is key, right? And so right now we have a flyer, and we've kind of teased that on one side of the flyer it's QR codes, and on the other side of the flyer it's good old fashioned phone numbers. And it matters to our team members, right? That they can, if they're the type that gets out their cell phone and scans a QR code to get their needs met, or if it's like, no, I want to talk to a live human being. I feel like those who are leaning in on wellness are paying attention to the workforce. They are paying attention that there is a wide variety of individuals who you need to tailor your approach to. And those who will survive are those who have the flexibility and the adaptability to recognize the unique needs of each population and meet them where they're at. So I think choice is going to be king. I think also if you can um, allow for those who maybe have a level of, and I hate to call it resistance, but let's call it reserve, where they're like, wait a minute, I don't want to have to sync a device. And it's like, cool. Do you want to just manually enter it in? Yeah, we'll give you credit for that. It's showing up and saying, I understand that you may not want to do it this way. Would you like to do it this way? That personalized pathway, I think, is going to be the way going forward with that many generations. The other thing I think that's coming into play is how we're going to continue to look at the multidimensional way that wellness contributes to well-being. What are all the different threads that lead into that broad cloth that is our overall well-being? And so the more we're able to pay attention to how a sense of belonging is a part of our overall well-being, how we can pay attention to I'll go on a tangent here. We're really embracing that there's a lot more discussion on women's health and wellness. And so I'm really glad to see that a lot of our partners, including you, are jumping in and saying, hey, Prisma Health has an 80% female workforce. We need to be okay talking about resources for if you're going through menopause or if you're going through a miscarriage. And so that's some of that dynamic of, for some, it's like, okay, can we talk about this? We need to talk about it. And we need to create safe spaces that people can talk about all dimensions of their wellness so that they can feel a sense of well-being that's contributed to by their employer. Full transparency, I don't think your employer should ever be your totality of wellness, but your employer should be a contributing resource to your wellness.
Absolutely. And if you think about Prisma Health, I love that you went to the women's health route because all the resources that you have available at Prisma Health for the community, and then also the employers that are in the Greenville, Spartanburg area, being able to connect to those resources as well, because definitely seeing the women's health, definitely seeing personalization, Jay, definitely seeing configuration, but that it's very clear and crucial that personalization is top of mind when it comes to health.
More and more wellness and well-being needs to prove its mettle, and it needs to prove it in new and interesting ways. And I think one of the ways to do that is to take advantage of what we're doing. We've got a captive audience that is participating in a program that is incentivized. While we're there, what else can we do? Well, we can get them to all of these underutilized resources. We can get them to the things that we know traditionally have been tried and true ways to change behaviors. You know, there's EAP programs out there that for years have had less than 1% utilization. I'm not even talking about engagement, I'm talking about utilization. They're at every employer group, and they can be so valuable to someone in need in a wide variety of things. And unfortunately, no one knows about them, and they're just not very good at getting word out. So the least we can do is try to contribute, is to try to get people to the resources they need, if that's EAP or financial or coaching or whatever. I think the key to well-being is understanding the participant. You've talked about this many times about listening. The way a platform listens is through data and understanding, and then presenting you with what we heard. And we're just going to continue to double down on that. We're personalizing on survey data. We're personalizing on biometrics. We're going to continue to ingest these data sources that allow us to understand participants' needs better. Looking at clinical, looking at personal life stuff, looking at the what you're doing at work and understanding, absenteeism, presenteeism data, productivity data. All of those things allow us, not in a creepy way, hopefully, but in a way that is
Using data for good.
is caring.
Yeah.
We're trying to be caring about it.
I'm looking forward to digging into the multi-generational aspect, Steph, that you brought up, because when you think about that, each generation is different, needs are different, wants are different, and just making sure that we're collaborating, listening, and bringing data back to them that is, engaging. And so looking forward to digging into that. That's something that's very key for us in the future and navigate when it comes to communication and education. How we communicate to one generation versus another is very important. I think it is also crucial in the next personalization aspect of well-being. So, so Steph, this has been wonderful. We love the work that we do with you. I'd be remiss to not also mention Kim and Libby who work on your team. Those two are definitely, I think, part of the well-being team at Prisma Health, and love what they do there for you. And so thankful for our relationship, and that we've earned the right to do more with you guys as our relationship has progressed. But this is my favorite part of the episode. This is the best day ever. I wear vests. Our team loves it. There'll be lots of pictures of vests coming out soon, I hear. Steph, give us something that, maybe is something that's positive, that you might call a best day ever, something that is a good thing, the recent experience, or something like that. We always like to end the episode on a high. So maybe give us a best day ever.
So I think one of my best days ever was when we did our year-end wrap-up for the wellness portal. And I got to share the outcomes with the Whole Self Wellness BRG. And they were so pumped to see all of the different outcomes. And I was clicking through the slides, and they're like, we know it's amazing. Can we talk about what we're doing next? And so I thought it was great, because I tease all the time that I think my love language is PowerPoint, because a lot of times relationships matter, but you kind of want to point to data so that people understand it's not because I like you, it's because I believe in you, and the data helps me believe in you. And so it was one of those things where being able to kind of point to the data, show them the slides, all those types of things, I realized that we had established that pattern of like, they just expect good things now from the portal, and they're just excited about what we can do next. And so that was one of those things where I was like, okay, this matters to them. The Whole Self Wellness BRG now understands that this is their portal. This is their opportunity to not only help their wellness, but to also help the wellness of their colleagues. And so it was just one of those moments where I was like, okay, this isn't work anymore. This is the joy of this, is hearing people be like, can we talk about what we're going to do next? Could we try this? And Kim and Libby are like family now. So of course I always bug them. I'm like, hey, can you present to the Whole Self Wellness BRG? Or this is what they came up with. Can we do recipes on the photo gallery? And I can't tell you how much I appreciate that Kim and Libby lean in, and they're like, let's see what we can do. And it's usually pretty amazing what they come up with. So that would be one of my best day ever at work. Now, you know me, there's some best days ever, like me
Like swimming with giant whale sharks. By the way, I love that. Thank you for saying that about our wonderful staff. Navigate is an orchestra. It's not a solo act. And I love that you would say those things. And I'm grateful for that. We all are. So thank you for that. But you're going to go somewhere else on a best day, because I wish we could show the picture of you swimming with the whale shark, where it looks like the whale shark's eating you. You were either like in Dubai or Maldives, somewhere like that. I mean, what other best day thing you got going on? Hopefully not swimming with sharks.
So one of the wellness strategies that I and my family believe in is that every 90 days, it's good to get away. One, it helps you with succession planning. It makes sure that whatever you're leading at work can survive without you, because the work is important. And two, if you win the lottery, you need to be able to jump away. No, but also just for your own wellness, right? Get away every 90 days. And for me, it's about going to different cultures, experiencing life. I have a 13-year-old, and I want to make sure that she gets to see all the different aspects of the world. So we do like to travel a lot. And you're right, Dubai was last year, but the year before that was the Maldives. And so we were excited to see the whale shark. And so we had gone out one time, two times, and this was going to be the third time we were going out, and we hadn't seen the whale shark. And as we were coming in, we heard that there was a whale shark. And so we were able to jump in the water and swim. And the whale shark came towards me, and my husband caught a picture where it looks like the whale shark is going to eat me. Please no, it's not going to eat me. They're gentle, but they are the size of a bus. And it was one of the most serene experiences that I got to have with my family in the water. But again, it's part of that dynamic of, I love my work. I'm so thankful for my work. I'm thankful that I get to bring wellness and aspects and resources of that to my team members. But you also got to remember there's life out of work. And so you want to go and experience that too with your loved ones.
I love it. Jay, what do you got, pal?
I had a birthday the other day, and I had 45, in case you're wondering. And my aunt, who is retired from a retired executive from the oil and gas industry, had a really nice long conversation with her, and she's very interested in what we're doing here. Not super familiar with the well-being space, but just the business aspect of what we're doing. She, as a retired executive, kind of likes to hear what's going on in the business world. So, talk to her for an hour about what we've got going on. It was just a lot of fun. It's gratifying to have a conversation with someone who's so interested in what's going on in your life. So I just, wanted to say that was a really nice day for me.
Happy birthday, buddy.
Thank you.
Again.
Yeah, happy birthday.
Yeah, March is big here at Navigate. Best day ever. March 1st happened to be my birthday. There's a number there. We'll just leave that out. But what I love about, this time of the year as we're March Madness and the tournament, the cultural phenomenon that the basketball tournaments, both women's and men's this year. It's always been men's and women's, but like I love how the women's tournament and is just getting the attention that it is and deserves. By the way, 9.9 million people watched the national championship last year. That was largest ever. Iowa was in that one. But I just, I love the human spirit. I love the good that can be done. When you're watching all those underdogs, you're watching those 18, 19, 20, 21-year-old kids work together from every place in America and the world, quite frankly. You're seeing, no matter where you are from, no matter what you look like, no matter what your provenance is, it doesn't matter on the basketball court. It's just something that I just love watching. I love the game. I love the celebration, the resilience, the joy of competition, and I can't get enough of it. This is my favorite part of the year. I just love watching those kids and the men's and women teams just show all the hard work that they do, and also see all the coaches, the hours and hours and hours that those coaches put into those kids that help teach them, help lead them, help shape them to be, citizens of character. And I love it. So, cheers to all the double-digit seeds that are out there. And I'm ready for a double order of onions. If anybody knows a little Bill Rafferty, onions. But that's my best day. And Stephanie, thank you again for joining us. Jay, as always, really appreciate it. To everybody out there, thank you so much for listening to us. Continue to subscribe, continue to like, give us suggestions. We will listen. Also, thank you all for what you do every single day for others. Keep doing good things, and we'll see you later.